Do you know the compliance status of all the care equipment in your organisation across your sites? If your care equipment falls out of compliance, do you know the risks? In this video, we will cover the regulations you need to consider and the risks you could face if your equipment isn't compliant. The LOLA regulation relates to all lifting equipment, including mobile hoists, ceiling hoists, and their accessories such as slings and scale attachments. The regulation requires your equipment to receive an inspection every 6 months to judge whether it is safe to continue using, or if any recommended or mandatory repair works need to be completed to keep it working. Upon service, the engineer will certify your inspection with a service sticker. If there is no sticker or the date is overdue, then your equipment is out of compliance. The PURE regulation encompasses all equipment used for work, including the lifting equipment which falls under LOLA. The other equipment which comes under PURE include profiling beds, assisted bathing equipment, shower trolleys, couches and plinths. PURE requires your equipment to have a service and maintenance visit annually. This ensures your equipment is maintained in a good condition. If you do not abide by this regulation of annual servicing, and your equipment is out of compliance. Within the Health and Social Care Act, Regulation 15 states providers must meet the requirements of relevant legislation. To satisfy this regulation, the regulating authority, CQC, will make sure you have the correct paperwork for your equipment, including in-date inspection reports and stickers on the equipment being used. If you provide bed rails within your care facility, you will also need to make sure you are compliant with the bed rail regulations, BS-EN dimensional requirements. Further information about these regulations are available on our blog pages. There are several risks associated with the care industry when the equipment falls out of compliance. The biggest risk of falling out of compliance with the health and safety regulations is the cost and devastation to people's lives if an accident occurs. There is a bigger risk of an incident if your equipment isn't regularly serviced and maintained. If your equipment falls out of compliance, or if you have an incident, the maximum penalty from the CQC is an unlimited fine. For most care providers, even the smaller fines would be a massive blow, and many have closed down or gone into liquidation as a result. When an incident occurs, CQC publish information relating to the incident which local and national news outlets can pick up and report on to the wider public. The stigma of these stories can last a while and cause irreparable damage to the reputation of a care facility or group. Any damage to reputation can then result in a loss of revenue. Many of the regulations place some of the responsibility on the staff that use the equipment, including checking the equipment has an in-date service sticker before using it. If there isn't a service sticker or it is out of date, the equipment must not be used under any circumstance. This needs to be reported to the relevant people responsible or your service and maintenance provider to get this rectified as soon as possible. Medeco has worked with care providers over 30 years, ensuring their compliance, keeping their equipment up and running, and their clients safe from harm. For further information on the regulations or maintaining your equipment, visit our blog pages. If your equipment is out of compliance at any of your sites, get in contact with Medeco to see if we can help.